Hello again, I'm Dr. Herman, and recently you had signed up to receive emails on my fibromyalgia website, and I'd like to inform you about a certain kind of part of your fibromyalgia condition that has probably troubled most of the physicians who you've met, whether you've gone to the hospitals or you've met with certain specialists like rheumatologists or neurologists, or maybe you've gone to the chiropractor perhaps, or you've tried the different medications like Lyrica or Neurontin or gabapentin or Cymbalta, and a number of different medications that may have been out there. What I want to help you understand about your fibromyalgia pain and your fatigue and possibly insomnia and the trigger points and the pain that moves throughout your body and bowel problems and a number of things. And what these doctors are not getting at is, or what they don't understand, is that your brain itself may not be doing the job to control the pain and the function of your body. That's right. Your brain can actually weaken in its abilities to carry out the normal daily routines to keep you functioning normally and feeling good. I went to school to get a degree in functional neurology. And functional neurology is different than medical neurology. You see, medical neurology is good for a lot of things, but for the chronic pain that you're suffering with, medical neurology is most likely and most often, not always, but most often, it's about prescribing you an anti-anxiety pill or an anti-inflammatory pill or a muscle relaxer or some kind of pain relief. And the problem is they're not getting to the root cause of your fibromyalgia pain. In the world of functional neurology, we understand something different about your human brain. And I've got this nice big color chart on the wall about your human brain. I want to educate you a little bit about this, but what we understand is you can have what we call a functional disconnection syndrome. Functional disconnection syndrome. And what that term means is that parts of the brain that control specific parts of your body are not working right. I want you to understand something about your human brain and why we're so successful in treating people with a chronic pain condition like yours, is that your human brain is an electrical machine and it controls the body. And I want you to think about that brain like the engine in a car. And when your engine needs a tune-up, let's say you drove that car for 20 years and never changed the spark plugs, never changed the oil. You've been putting food into it, you've been putting gasoline in the car, you get it? But you've never tuned it up. What do you think is going to happen to the way that engine runs if you don't change the oil and if you don't change the spark plugs? Is it going to run normally? Most likely not, right? It's going to run abnormally. None of you, or most likely none of you, have driven a car for 20 years and not changed the spark plugs, changed the timing belt, had an oil change, had a tune-up. You've done the things to keep your car working. And what we all as humans kind of lose sight of is that we need tune-ups on our body. And you've got to understand about the human brain is that it can get tired, it can get weak over time from all the stress in our lives. And there's a number of systems that I'll be going about in other videos with you to help you understand what stresses can cause the brain to fatigue and not work the way it's supposed to. But you've got to understand that your brain, like that engine, has little spark plugs, so to speak, that are supposed to make the brain fire to different parts of the brain and help to control the function of the body. So when you see on the commercials for things like Lyrica, and for some people it's worked, but for others, and the reason why you're watching this video is probably you've tried it and it hasn't worked for you or your loved one, is that they say that the nerve endings are overfiring and they can't control it, so they use an anti-epileptic seizure medication to decrease the brain function. Who wants their brain working slower? And you probably don't have epileptic seizures. So why are you taking an anti-epilepsy drug? Understand this. You have to have normal feeding forward mechanisms of all of these parts of your brain. You have what's called a cerebellum that controls your balance. It controls your coordination. It controls your spinal muscles. It even has little cells located in it, and these little cells, called the Purkinje cells, are they need to be stimulated properly in order for them to inhibit pain in the body. If you have parts of the cerebellum that are weak, they're not going to be able to fire to their Purkinje cells. You don't have to remember that name, but just understand something, that if these cells are not fired to properly, they're not sparked properly, they can't send down the messages to inhibit pain in the body. I've taken so many patients where I've realized with them and helped them realize that their cerebellum may be weak, and we've done things to actually strengthen that cerebellum, and literally right in front of their eyes, in front of my eyes in the office here, I've seen people with pain that has gone down for hours or days after just a few minutes. Let's understand this. Your cerebellum, when it's working at 100%, it needs to feed forward signals through these different regions of the brain to the frontal lobe. And when your frontal lobe gets weaker, it may not be able to carry out tasks to control your bladder, or control your colon, or control your blood pressure, or control different functions of the body. Maybe you're having weakness in your legs or your arms, all because this part of your brain is just weak, and it needs to be exercised. It needs stimulation. It's not connected properly. Just like in your car, if you don't change the spark plug and you have two of your spark plugs that are not doing their job, your car is not going to start and run properly, right? So understand this, that you can have a functional disconnection within the cerebellum. You can have a disconnection or a slow impulse going from the cerebellum to the frontal lobe. We have another area of our brain right here called the temporal lobe. The temporal lobe that we can study in the office here, and I can prove to you and show you how we can see if it's weak and make changes. But this temporal lobe is responsible for your memory. It's responsible for you to be able to think of words and make them in your brain and speak. It's responsible for sense of smell. How many of your doctors have ever checked you for your sense of smell and the right type of test for sense of smell? Rarely do I ever hear that patient have been tested for their sense of smell. Tested for temporal lobe function to see if it's doing the right job. There's another part of your brain right up here called the parietal lobe. How many of you have been told by your doctors that all of the sensory nerves that you feel pain with have roots somewhere? Like a tree that grows out of the ground has roots in the soil. If those roots are in a bad soil, do you think that the tree is going to grow and have fruits to bear and have branches that keep growing and have leaves that turn green? What if the soil is so poor and it becomes like a barren desert? Do you think the tree is going to grow and bear its fruits? I mean, think about that. This part of your brain, if it's weak, when it's weak, and we can study it and we can treat it, and you'll see a change in my office here, when this parietal lobe is weak, this parietal lobe is not able to send the sensory feeling functions throughout your whole body. So you may say, oh, why do I feel numb in my feet? Why do I feel pain going through my legs? It's worse on the right than the left, and then it's worse on the left than the right. Or it's worse down this arm than the other. And it's not from a disc problem in my spine, Dr. Herman. I've already had my back checked, and they tell me there's no disc problem. There's no arthritis. Why is it that I'm suffering? Or I've already had injections into my spine for the disc problem. Why am I still suffering? I've already gone through therapies, and I'm still suffering. Nothing is working. The doctor in functional neurology has to look at the parietal lobe and see if it's disconnected, so to speak, if it's not firing with the good spark plugs. We've got to see, is there a connection from the cerebellum through the parietal and the temporal to the frontal lobe? We've got to see if this brain is now calming down other functions of the nervous system that go through your spinal cord into the body. You deserve to have your brain checked. And that doesn't mean, well, I've had a CAT scan or a brain MRI and they don't find anything. Or I've had EEGs of my brain and they're telling me that the brain is firing. Well, great. But is it doing its job? There may be no tumors, there may be no cancer, and thank God for that. But if your brain is not firing properly, and your doctor who checks your reflexes and checks your sensory and touches you in the shoulders and looks at your eyes, tells you everything is okay and they don't know why and it's all in your head, and your spouse is looking at you saying, what is the problem? Why can't you get well? The doctor doesn't get it. The doctor doesn't understand it. And what you've got to understand is the brain may not be doing the job. And in my training of functional neurology, I understand how to check the human brain function. I understand how to evaluate you with a comprehensive functional neurological approach. that will amaze you when you see what I do and point out to you what's wrong. And I will change you right in the office here. If I can't make a change with you right in the office here, then I can't do it either. I couldn't help you. And I am certain with my abilities that there's a way to figure you out, and there's a way to help you, and you can overcome this debilitating condition. And you don't have to just go to these support groups, and you don't have to try all the different medications. You can get well. I invite you to my practice, and I can help you. I'm somebody who understands you. I am somebody who cares, and I've made differences in lives. My number is 950, excuse me, that's one mistake in this video, 954-370-3100. Understand, you have a functional disconnection syndrome in the brain, and your brain needs a tune-up, and you can decrease the pain. And when you come in here for this evaluation, and after you've already watched this video, you're going to see some different types of studies and different types of treatments, unique treatments that will help you alleviate pain right here in my office. I look forward to meeting you. 954-370-3100. Thank you.